but she can identify. She cannot speak also, but she can identify in the mobile father's name, number, and she can send messages. So when they come for the fingerprints analysis they have taken, and they wanted to consult me for the thing, then we did the bars run. वो 4 बजे को सोई थी नहीं, हमारा बेटी ऐसा क्यों करते हैं, ऐसा नक को बोल रही थी उसका मदर। हमने किया तो कि अपॉर्चुनिटी तो दो, अब सोती है नहीं बाद में नहीं, सोने का जरूरत नहीं है, लेकिन करेंगे। तो क्या वो जस्ट द टच करते ही, ऐसा पॉइंट्स कुछ टच करते ही शी स्लेप्ट फॉर 20 minutes. Okay, within the 20 minutes, afterwards, after 1 week, they sent a message. Her speech clarity has improved.
जी जी सर। सर कभी कभी ना कोई बच्चे जो होते हैं, बहुत छोटे बच्चे जिनके साथ हम बात नहीं कर सकते हैं, लाइक
Yeah.
3 मंथ 2 मंथ, इवन न्यू बॉर्न बेबी, तो वो ना रात में रोने लगेंगे ऐसा। तो मतलब आपने बोला है कि एज इज नो बार, बट ऐसे में कोई पॉइंट को भी टच कर सकते हैं क्या, कि मतलब उसमें ऐसा टच नहीं करना चाहिए? आपका क्या राय है?
वो टच कर सकते हैं,
हाँ,
लेकिन वो जो मंथ्स का बेबी है ना, उसको
ओ,
क्या प्रॉब्लम है हमें मालूम नहीं है।
ओ,
उसको भी स्टमक में प्रॉब्लम हुई तो भी रो सकता है। उसके लिए पाँव में थोड़ा हल्का सा प्रेशर दब करे तो वो रोना बंद कर देगा। वो आंख प्रेशर में जब बताया था हमने,
अच्छा
पाँव
अच्छा,
में
पाँव।
करना है हमारा। हाँ, वो पाँव में करे तो हो जाता है। अभी एक तो सामने मैंने बोलना नहीं चाहता था सर, लेकिन वो बच्चा भी थोड़ा माइलस्टोन डिले है, थोड़ा मुश्किल है उसको, किसी से बात करना भी मुश्किल है उसको। लॉट ऑफ प्रॉब्लम्स ही हैड। जब भी मैं हैदराबाद जाता हूँ उसको बार्स करने के लिए 4 दिन मेरे पास ही रहता है वो। एंड द ट्रेमेंडस ग्रोथ वी हैव सीन उसी वो अभी आजकल लास्ट ईयर ऐसा बच्चा बीबीए एग्जाम में 31 पेपर्स ही हैज क्लियर्ड इन 1 ईयर। 31 पेपर्स। और he cleared
वंडरफुल।
LIC exam also. That is because regularly we were doing every year, twice I go to Hyderabad. Whenever I go 4 days he will be with me. क्या होता है बोले तो उसको बोलना को समझ बोल नहीं सकते वो, उसमें क्या हो रहा है, why you want access bars, he cannot tell why. But when we do this one, he feels very happy and calm down, and otherwise no very aggressive behavior, and shouting, fighting, and throwing everything. So that kind of a behavior was there. It has calmed down, and now he is employable. He has come
राइट
to that stage.
राइट।
Okay, so then next one is like many people know, the one lady came to my clinic on the opening day. She was after doing 15 minutes on, because many people were there, I did only 15-minute sessions for the people. After getting up from the session she was doing like this. मैंने पूछा था क्या नमनेस आ गया क्या, हाथ में क्या हुआ? नहीं सर, मेरे को 4-5 साल से मुझे पेन था हैंड में, कुकर लिफ्ट करके बाद में रखने के लिए मुश्किल होता था। अभी तो वो पेन नहीं दिख रहा है, इसीलिए मैं वंडर हो रहा हूँ क्या हो रहा है बोल के।
वाह।
Only 15-minute session in one day. And afterwards, for 2 months, I followed up. Are you still getting it? Are you still getting it? She never got back that pain.
सर
So that is
आई
the
वांट
power of.
Sir, I want to ask some questions. Is this a good time, or you want to say?
Yeah, yeah, you can ask.
Okay. Sir, in the beginning you showed, आपने दो लीडर्स जो एक्सेस बार्स जिन्होंने शुरू किया उसके बारे में बताया। फिर आपने ये
Mm,
भी बोला कि ये पॉइंट्स जो है वो एक्यूप्रेशर वाले पॉइंट से अलग हैं, आपने ये भी
mm.
बोला। तो फिर उन्होंने किस तरह से डिस्कवर किया, अगर आपने कुछ बताया, या मतलब उनको ये ज्ञान कहाँ से आया, या सिर्फ कुछ बताएं
तो
थोड़ा सा।
वो अभी हम भी कर सकते हो, हमको भी आया था ऐसा ही जो वो बताया था।
अच्छा अच्छा।
डगलस, कैरी डगलस। सो क्या बोलता है, जब आप पॉइंट्स को सर्च करते हैं, when you are sliding your fingers like this, at one point you will get the point. So then your finger movement will stop automatically at that place. For some जब स्ट्रक्चर थोड़ा अलग से रहता है ना किसी को, इधर हमको मालूम नहीं होता है, we cannot get the points easily. Okay, so when we are touching, when we pull our fingers like this, we pull like this, then at one point we feel that yeah, that is the point, and there it will start. So that is the beauty of this. Easily one can find out, but it needs a practice.
नहीं सर, प्रैक्टिस की
Okay,
बात तो
so
ठीक है, बट
yeah,
जैसे आपने बोला था कि एक्यूप्रेशर चाइना से आया, या हमारे ये जो नाड़ी का सिस्टम है वो हमारे पंचकोश में ये सारे पॉइंट्स होते हैं, ये एंशियंट
uh,
हिस्ट्री या एंशियंट आयुर्वेद या
mm.
एंशियंट सिस्टम से आया। तो ये एक्सेस बार्स तो अभी आपने बोला न्यू एज का सिस्टम है, तो उनका उसका कुछ बेसिस है क्या सर? ये एक्सेस बार्स का
yeah,
कुछ
the basis बोले तो that is energy circulation. He was a chiropractor. Yani that bone setting वगैरह and that hair massage and all those things they will do. And for such a person, when he was doing something transformed for him, and actually I will come to the next slides. There are questions are there. When we are in the question mode, all of you can practice that more easily to solve the personal problems. Okay, so I'll just quickly cover one or two cases, or maybe let me see what all I have covered so far. Okay, so then I was applying the knee oil for the knee pains at that time, and then 2 floors coming in the evening and climbing, getting the key for the first floor and all. I was getting irritated, and घर में the moment you come to home you start shouting. मैंने बोलता है मैं बेल प्रेस करे तो तुम आके की क्यों नहीं दे सकते? हमने सोचता है आके आप भी टीवी के सामने बैठते बोल के, ऐसा झगड़ा कुछ ना कुछ होते थे. So the key, the moment, the idea here is because I'm climbing 2 steps, 2 floors, I'm getting knee pain, and immediately fighting and all used to start. And night I used to apply the oil for this my knee pain and all. So one day when the realization where it happened, what happened is there is a statement particularly in the access bars which we are going to discuss about next 15 minutes about that. Okay, so there was a statement, who does it belong to? And till that time I never had pain for last 2 years. Uh, previous 2 years यानी 2010 तक नी पेन नहीं था मुझे. देन बाद में शुरू हुआ. देन हु डज इट बिलोंग, किसका होता है वो पेन? So the question is that PODPOC, POD, POC. Who does it belong to? PODPOC. Who does it belong to? PODPOC. Then I had one realization at that time. 2010 में हमारा 9 में हमारा मदर पास्ट अवे हो गया, 10 में फादर पास्ट अवे. सो 9 में when मेरा फादर केम टू बैंगलोर, मेरे साथ लेके आया था उसको, डेली नाइट में ऑयल अप्लाई करता था मैं. सो द नी प्रॉब्लम एंड एंकल प्रॉब्लम ऑयल अप्लाई करके करता था. वो हमारे पूछते थे, अरे इतने रात हो गया, 10 बजे 11 बजे हो गए, जाके सो जाओ, अभी करने का जरूरत क्या है बोल के. लेकिन ही यूज टू लव दैट. ऑफ कोर्स आपका लव एंड अफेक्शन वी आर टचिंग एंड देन डूइंग इट ऑल द थिंग्स, but somewhere in my mind I used to do to my father and he used to enjoy it, his pain was reducing. That was there in my mind, and I was carrying forward that statements. Okay, whenever I apply my oil for my this one, I used to remember my father. So that means that connection became so deep that I am carrying the pains. When I did the access bars and when I realized it, that is, I cut that statement that podpoc is point of destruction, point of creation. यानी कहाँ वो थॉट आता है, कहाँ वो प्रॉब्लम शुरू होता है, हम कट करके भेज देता है. इट स्टार्ट्स क्लियरिंग मिलियंस ऑफ पीपल्स problems. That's what they say. Okay, so that is the one, and immediately within 2 weeks after my access bars class, the pain has vanished for me. Till today I never had any this one knee pain. Okay, so that is the power of access bars, and the statements are much more powerful. I will tell you that statements now. Okay, so when I did for the family doctor also, uh, 1 year migraine, yeah. Migraine, one person used to take daily some 4 tablets in the early hours, morning and all. 12 sessions we did for him. माइग्रेन कम हो गया, उसका टैबलेट्स लेना बंद कर दिया. एंड नेक पेन रिड्यूस, ग्रोथ रिटार्डेड चिल्ड्रन जैसा मैंने बताया था वो किया था उसको. एंड 3-4 पीपल द ग्रोथ रिलेटेड चिल्ड्रन, एडीडी एडीएचडी बोलते हैं, ऐसा लोगों को किया था. बहुत अच्छा ये हुआ. और हमारा इनाग्रेशन का, क्लिनिक इनाग्रेशन का टाइम पे हमारा फैमिली डॉक्टर को भी बुलाया था, वो भी आके करके, पर 15 मिनट कैसा चले गया पता ही नहीं। उसना बस का तो मेन रोड का ऊपर है हमारा क्लिनिक, बसेस कितना जाता है, वो 11 बजे के टाइम पे पीक आवर बसेस है। उतना साउंड में भी उसको गहरा नींद आ गया। एंड 15 मिनट्स ट्रीटमेंट एंड 3 hours स्लीप बाय वन फ्रेंड। Okay, and then yeah, somebody had this 40 lakhs debt, किसी को दिया था, और बहुत डेली he was getting anger, 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 and after this session of this one, mind has calmed down and his behavior has changed. We can cover at least few statements, 5 6 statements which you can use. uh, Probably you can note down, or we can send it, I can send these points in the WhatsApp to the people those who have attended today. We can send that. All of life comes to me with ease, joy, and glory. They suggest these statements is verbal, and they create the consciousness in the universe level, and then they bring something to the universe, from the universe to us. Okay, in the meditation, positive thoughts and all those things, whatever we tell, and then leave the question to the universe, and universe will give. This is exactly how we are doing it here. One is, all of life comes to me with ease, joy, and glory. 10 to 20 times a day. You can morning or evening, anytime you can do it. That means everything that comes in abundance with joy and glory, it will come to me. It could be good or bad, anything it will come. But you should be in a position to accept it. Okay, so when it will not come instantly, immediately at that moment, but it can come maybe after some time, after few days or after few years. Okay, so I have experienced a lot of difference with this statement, and daily I chant like with all other my Gayatri and Mrityunjay mantra. This also is have become a daily chanting. इससे अच्छा क्या हो सकता है? Say today you got 1,000 rupees. इससे अच्छा क्या हो सकता है? You have not got anything. इससे अच्छा क्या हो सकता है? That means from zero money to क्या हो अच्छा हो सकता है? That means you may get 10 rupees, 20 rupees, 30 rupees. Or some situation, some event may happen which gives you delight, which makes you more happy for that. And suppose if there is a good phone call, somebody makes a phone call saying that we are looking for your help today for this one. I am very happy. How does it get any better than this? I'll think that. And when we are in that type of this, the fourth point says it, be in a question mode always. How does it get any better than this? Because these are all the questions here. No? What else is possible? How does it get any better than this? What else is possible? So the famous example, what they quote Gary Douglas, and this one is in airport when they are going. So they found on the checking point, they found more weight. So then he started asking what else is possible. They started calculating for the higher charges. And then what else is possible? When 2 3 times when you ask, that fellow put like this, and he will go and call his boss, and that said, so the check for overall weight and then send it. It happened now with my daughter, my son. Every time I do this, and every time with smooth baggage. Not only this, what else is possible? You are in a situation today, you are able to get good food, or rather the tasty food you buy from outside. What else is possible? Some other thing will come to you. In any situation, whatever good situation, bad situation, or unknown situation, doubtful situation, you can use these three statements. Suppose if somebody's health is not good in the house, and you are not able to get the proper treatment, not even proper diagnosis is happening, our spouse, our children, something. What else is possible? What else is possible? What else is possible? Just keep chanting sometime. Some possibility will come from the universe. Okay. How does it get any better than this? Suppose somebody is ill, and when you are chanting this, how does it get any better than this? Some proper treatment will happen. So be in a question mode and keep asking these three statements on a daily basis, and it will give you a lot of change in your life. And another important question I will tell you, uh, who does it belong to, and POD POC. POD POC means it is point of destruction, point of creation. And who does it belong to? Suddenly some stray thought comes up, some death thoughts comes, some irritation thought comes, which normally we don't think of. So that time, who does it belong to? Podpoc, you can do that. And my pain, knee pain, I said I was using podpoc statement. So this kind of a things, no, we can use it. So this is with a lot of their work. Okay. And you can just practice these statements every day, something different. Ask what difference I can be today. What is right about my situation? I am not getting it. 5 6 times we can repeat. Suppose if we are in a tough situation or whatever happy situation, what is the right about my situation? I am not getting it today. 5 6 times you will do it, you will get the answers for this one. Okay. So interesting point of view that you have this point of view. This is another important statement, where when you are was not there earlier, later they had it. Right and wrong, good and bad, pod and pock, online shops, boys and beyond. Each word has a different meaning, and uh, they carry a lot of energy. They carry a lot of energy. In fact, in a traffic situation, when I used to drive 2 hours almost daily, it used to take in the morning to reach office for the driving. I used to get in the traffic signals, the right and wrong, what else is possible, what else is possible. Suddenly, 5 signals will be cleared for me with.
Or does not spiritually inclined or can also use all these techniques, no?
Everybody can use this techniques.
Okay, sir. Okay, thank you. Thank you. That
Yeah,
one
this
was
is
very
actually this is you are asking the question, and you don't try to look for the answers. Okay, so suppose if somebody wants to have a good environment, how does it get any better than this? How does it get any better than this? Just keep asking. You don't define what is good for you and what is good environment. It should be like this, it should be like this. Don't, no, don't do that. So universe knows what is right for you, and they
surrender
will
to
try
the
to give.
universe. Surrender to the universe and accept it.
Yeah, put the questions to universe, and the universe will give you things. Say, when I was in this question mode, there was, and people call, even I read the book called the ADD ADHD, the mm, pragmatic psychotherapy, psychology, pragmatic psychology. ADD ADHD, and these are all the uh, they brand the children based on because they cannot solve all the problems. But here what they say, it's a differently abled. When you are running the bars for that, you get to know more and more opportunities what the child is going through. And really, you cannot believe it. I was treating one person, uh, 16-year-old boy who cannot talk. Only few words he can talk, but tongue twisting is not possible. He has been spastic since age of 6 months, and then several doctors have seen him. And last time on acupressure, I was telling that he cannot bring his hands like this. So I did this one zone therapy, and after few sessions, his hands have become normal. For him, regularly zone therapy and access bars I used to do, and I used to train him on something else. The tremendous potential. One questionnaire I give, I never expected that he will solve that questions. He solved, not only solved, whatever the English I am talking to you like this, I was speaking to him. And now I don't know how he was understanding my language. He is a Konkani guy somewhere near this one. He will understand. And he used to respond to my things and act. And then he was doing it. So that is the miracle that access bars or acupressure or bachelor remedies, all these things are carrying. That's what I just, my campaign here is, the systems are excellent systems. They work with all the alternative therapies or all the rather regular therapies, no side effects. Things will change for the people, whether it is a person having a physical problem, psychological problem, or no problem at all. If there is no problem, happily one sleeps 3 hours, 4 hours, a good rest, they will get it. So this is what I just wanted to. I'm happy that I got this platform. Thanks to Anuradha ji for giving me this opportunity. And thanks to all the participants,
Thank you.
Madhulini ji and
Thank you.
Prasad, Annapurna and Shantala ji. So any doubts, any personal doubts you have, you can ask me. And particularly suppose if the health of a person, family member is not good. You can repeat